It is Tuesday, September 8th. Welcome to our COVID-19 Task Force update. Today on the program, we'll have a couple of presenters, and we also will have a debut of a brand new Zuze video, so we are looking forward to that. There's lots in the news today, and I know Lloyd Phillips, when he joins us, will give us some updates of what's happening around and how it will or could affect us. But before we do that, we'd like to introduce the Executive Director of the Kahnawà Memorial Hospital Centre and a member of the task force, Lisa Westaway. Lisa?
Thank you, Joe. As we know, cold season is upon us, and we're already seeing some impact of that in the community. So many people who are having cold-like symptoms, which are very similar to COVID-like symptoms, and therefore our testing has started to increase at the testing site. So we've really increased from approximately 3, 4, 5 per day to up to 11, 12 per day, and we expect that number to continue to increase. This is a positive sign. This means that you're following your symptoms, you're paying attention to your body, and you're calling for testing when required. So we thought it would be pertinent today to review the symptoms for testing. So I'm going to go over those with you. So there are 2 different categories of symptoms that you should be looking out for. So there's the A category and the B category. In the A category, if you have one of the following symptoms, you should call for testing. So that's a new cough or worsening of a chronic cough. If you have fever or chills, so an adult fever is 38 degrees Celsius or anything higher than that, taken orally. Difficulty breathing, sudden lack of taste or smell. So if you have any of those symptoms, you should call the testing site at KMHC to be tested. The B symptoms, you would need to have 2 of those symptoms to be considered for testing. So the following symptoms are new onset headache, new onset pain, so whether it be muscular, chest, abdomen, or joints, new intense fatigue, loss of appetite, sore throat, diarrhea, or vomiting. So if you have any of those symptoms, you should have 2 of those symptoms to call for testing. If you have one of the A symptoms, you call for testing. This self-monitoring tool exists on the KMHC website. So really, we urge you to go and look at that tool, to print it if you can, and to keep that in mind every single day when you wake up in the morning so that you can make decisions for yourself about whether you need to be tested or not. Now, just to demonstrate how we're being a lot more cautious in the education system, students or teachers are completing this tool on a daily basis. However, they are staying home if they have one symptom of both A and B symptoms. So no matter the case, they're staying home, no matter whether it's one symptom or 2. So we're being extra cautious in the schools right now so that we can be sure to catch any cases very early on if they exist. So just to keep the community updated, we still have not had any positive cases from our testing site, nor from the testing sites surrounding us, even though we have increased testing. So we wanted to keep you focused about that. We have been testing from all of our community organizations, including the schools. So people are being very mindful and focused on their health, and they're calling to be tested. So we urge the community to do the same on a daily basis, because this is how we're going to contain the virus. As you can see in the news, we see that numbers are increasing around us. We see that we're not going to avoid a second wave. We're at the bottom of it, and we're slowly moving up. We've had some increases in cases daily over the last week or so. We'll continue to follow the trend, but the important aspect is that you continue to self-isolate, that you wash your hands, you maintain all of your hygiene measures, and you keep your distance. So even if you do have a positive case, by maintaining your social distance from those around you, you're protecting them and you're limiting the spread of the virus as we move forward. So considering that we're doing more testing, we wanted to just give a brief summary about who can be tested. So of course, anybody that meets the criteria that I just reviewed would be a candidate for testing. But we do also have other categories for testing. And as you can see here, I mean, you can't read this, I'm going to review it with you, but we have priorities for testing that are set by the Quebec government and that we do have to follow. So we're not at liberty to test anybody we want to test. We have to follow this criteria. And in fact, every single test that we do is categorized according to the categories on this document, and that's provided to the lab. We don't actually process the test here in Kahnawà. It goes to an outside lab, which is the case for all the testing sites. And we, based on the category that we place on our documents, that will determine the speed at which the test results come back to us. So there are some categories that are in red, and of course those are categories for people being tested who are in a hospital emergency setting or are in a long-term care facility, healthcare workers, those who are going to be having a transplant in the next day or so. So those are emergency situations that where we receive test results very quickly. There are other areas for testing for either contacts of positive cases who have symptoms, sometimes those who don't have symptoms if it's requested by public health. And then we also do screening. So we sometimes will do screening based on public health recommendations. As you know, we screened all of the workers in our, from our long-term care facilities and for all of our residences. We also screen for anybody who's going to be requiring surgery and where the hospital asks us to do a test. So that's called a screen. When you do a test for somebody who does not have symptoms, it's a screen in order to allow them to move forward. So there is, however, one area that we no longer can screen for, and we have been in the past. So this is a change that I wanted to advise you about, and that's regarding people who are asking for medical certificates to be able to travel or return to school. So in the past, we were doing screening for those particular cases. We are no longer able to screen for those cases, and this is based on specific requirements from the Quebec government. They will not process those tests that come from our testing sites. So should you have the need to be screened for school or travel, then you would be able to do that through private clinics, and we're going to have that listed on the KMHC website to help you. So they're private labs who will do those tests at a cost. So again, we urge you, if you have symptoms, to call the testing site to be tested. When you're tested, you need to self-isolate until your results come in, and at that point your results will be provided to you from public health, and they will let you know whether you can return to work or school or to your regular activities, or whether you need to continue to self-isolate, and that is based on an investigation that they'll do when they contact you. So we'll keep you posted regarding the increase in cases as we move forward over the coming weeks, and we'll best advise you on the actions that you should take as consequence of this change and evolution over time. Thank you.
Yeah, well, Lisa, and you know, of course, the messages have been consistent all along, as Lisa mentioned in her talk here. We have been giving serious messages for a long time, and we will continue to do that here from the task force, as we are in a serious situation. But sometimes, in order to get your attention, you need to smile, and certainly this next video has the serious message, but you can enjoy it while you're watching it, and hopefully the message does sink in. So here with the world debut of the latest Zuzza video is Zuzza.
Day 151. Crops are coming in nicely, but still haven't caught that damn critter pilfering my harvest.
Oh! Hey! Didn't see you there. Kind of snuck up on me. I'm just getting some work done here in the garden. Hey! Hey! Get out of here! Anyway, now that I got your ear, why don't we go inside? I want to talk to you about something that I've been noticing in town. Let's go. Okay, so you guys are doing pretty good with your mask wearing and staying safe. But I gotta be honest, I've been seeing a few mistakes here and there around town. So today I'm gonna present to you some do's and don'ts of proper mask up procedure. Let's do it! Do wash your hands before putting on and taking off your mask. Do wear proper masks. That's not gonna work because it's got holes in it. I suggest wearing one that's made out of fabric. It's a lot safer and it's better for the environment. Hey, how'd that get in there? Do store your mask in a washable fabric pouch between uses, like that one there. Don't move your mask on your face. Hey, have you seen my VCR? What? Don't share your mask. Hey, I'm going in the store. Can I borrow your mask? You gotta put in, eh? It doesn't matter if you guys are second cousins. Just don't do it. Who the hell has poutine for breakfast? Do wash your mask and your pouch at the end of every day. Make sure to use detergent to get all the poutine smell out of your mask. Do continue practice social distancing even if you're wearing a mask. Doing so ensures that you are completing your three-pronged approach to staying safe. Washing your hands, wearing a mask, and keeping that 2-meter distance. Eh? Cut it out! Follow these do's and don'ts to make sure you are masking up proper. Now listen, Kahnawake, I know it's been a long time and we've been dealing with COVID-19 pandemic for a while now, but we've been doing so good. With the rumblings of maybe a second wave coming on the horizon, now's not the time to get lazy and complacent. Let's keep staying safe to keep everybody in the community healthy. So, I'm Jose saying, mask up proper, mask up safe. Ona!
Well, now Zuze, and again, if you're going to do it, and you should be doing it, do it right. All right, joining us now for his update after this nice long weekend, and by the way, I hope everybody had a nice, enjoyable Labor Day weekend. Joining us is the Commissioner of Public Safety, and of course, the head of the COVID-19 Task Force, Lloyd Phillips. Lloyd?
Thank you, Joe. Thank you, Lisa. Yeah, certainly good to see Jose back on doing another episode, which is very informative, but at the same time, Joe mentioned, put a smile on your face, and a little bit of humor sometimes could help make that message a little bit stronger. You know, and as he mentioned in the video, we are doing very well in Kahnawake. We have been going through this pandemic and very I guess as positive as possible. We had exceptional results throughout the past 6 months, and we couldn't ask for things to be any better. But with that said, we also have to make sure that we maintain the measures that we've been talking about time and time again. About hand hygiene, masks, distancing are all still the pillars and the cornerstone of what we're trying to maintain to minimize the spread or the possible spread of the COVID-19 virus. Now that we have schools are opening up soon. Many of the Kahnawake Ono's children are in school who go outside Kahnawake. Again, so these measures are equally as important. Whether or not what rules your school is following, when you come home back to Kahnawake, remember that we're all here working together to keep our community, as safe as we possibly can. It is a matter of personal responsibility. I know over the past couple of days we did receive a few emails or inquiries about various events in and around the community. Again, then we just look out and to the community as a whole and say, there's only so much that the task force can do, and even the peacekeepers, we also have to look inner to ourselves, and have that personal, responsibility to know when planning various events in the community, when you're leaving the territory, and obviously even within the territory to maintain that personal responsibility to keep yourself safe, keep your family safe, and ultimately, we are looking at keeping the entire community safe. Because there are examples out there in not far. Ontario has pushed the pause button on additional reopenings of various businesses over there because they're having a current spike in some cases. If you watch the news, the Mayor of Montreal was recently exposed to COVID-19 in a meeting with some other mayors, I believe the Mayor of Laval. So now she is in isolation, and I'm sure she'll probably end up being tested relatively soon. So there are examples of things that are still happening around us. There is a report that there's been approximately 70 cases throughout the province of Quebec in schools. People being tested positive, which obviously on the surface seems very alarming and seems very discouraging. And to be honest, it is to an extent. But at the same time, it's equally important to identify any positive cases, isolate them as quickly as possible, get them tested as quickly as possible, and then do contact tracing to ensure if there is a small outbreak or individual that is contained as quickly as possible, so that it does not become an outbreak, which could lead to obviously a cluster to outbreak and so on. So again, we got to remain very aware of our surroundings at all times. It's a very difficult time, and I'll repeat what I said last week as well. And as tough as it was to close businesses down and close down the operations of our community, going back to March, very difficult times, very difficult decisions had to be made. Moving forward and trying to emerge from that closures and taking those steps back to a new normal have been proven to be even more difficult. And we're always trying to balance out the risk to the community, risk to individuals, but also the need to get people back to work, the need to get some sense of normalcy back to individuals, looking at that holistic approach. So it's always a fine balance. And also looking at, I guess, the real threats to our community versus the perceived threats, because I know there's a lot of information out there on the news, depends on news media you watch. Sometimes there's contradicting experts, on various media, various forums out there. So that's why, early on we decided, we're going to focus in on an expert of our own, which is Dr. Gauthier, and we'll seek advice from her and have her, be that filter of all this enormous amount of information out there, and she could bring it to the task force in a clear, concise manner, and then we could obviously relay that information, to the community in the best possible way. Again, we just wanted to keep emphasizing the fact that we need to remain vigilant and keep ourselves, again, as safely as possible. Also, on Quebec released what they're calling their progressive 4-level regional alert system. Basically, they're looking at planning for the second wave of COVID-19. Here at the task force, we've been doing that for the past a few weeks now. Still a lot of work to be put into the plan, but we did start that work going back well over a month ago and now Quebec has released theirs. Mind you, it's very basic, but the concepts are similar to what we're looking at here. About having a phase in which they call vigilance, which we're currently in. On ours, we talked about about monitoring, but then a phased approach that if certain aspects are required, certain epidemiological information, containment issues of the virus, how much is it spreading, also the capacity of hospitals, all these things got to be taken into consideration on which level you have to be at, and it's a gradual tightening of restrictions based on all the scientific data and scientific information. So Quebec put out one that's very basic. Ours is much more detailed, and as I mentioned a couple weeks ago, we will be getting something to the community shortly. It is a work in progress, but do rest assured, although we don't have a detailed plan to present to the public at this point in time, we do have measures in place, we do have steps in place, we do have the outline, we do have a playbook. If we have to reverse what we're doing now, we do have those in place. But now it's just a matter of putting that together, in a proper package. Right now, with the opening of the schools, with the weather changing, as we all know, we went from summer to fall very quickly. More people are going to be gathering indoors. So obviously the risk is higher when people are indoors. Normal cold season is upon us. I know right now there's a cold virus going around the community. A few people I know have had the cold. Flu season, unfortunately, is also going to be coming around the corner soon. So, all these things in place, and I know it's very difficult sometimes to determine, do I have a regular cold? Am I getting the flu? Or is it COVID-19? So those are times that we have, as Lisa talked about, the symptom checker, and when need be, you contact KMHC, testing center, and you provide them with information, and they'll determine whether or not you need to be tested. So again, a lot of moving parts still. Even though a lot of ground has been covered, we have a lot of ground ahead of us to make sure that we maintain that great track record that we had in our community, and as well as, like I said, keep that holistic approach moving forward, keep moving in those monitored, clear, concise steps, and ensuring that we monitor ourselves very closely, which we've been doing since day one. So with that, I'll turn it back over to Joe to tie up for today, and we'll get back to you very soon. Kahnawà.
And thank you so much, Lloyd. And we will be back on Thursday for our next update. And remember, we endeavor to bring you the information that you need on an up-to-the-minute basis. These days it's twice a week generally, but if we need to come on a little more often, we will do so, especially now that it looks like we may be heading toward a second wave. We don't want anyone to panic, so we will just continue to make sure that we give you the up-to-date information. With that, we'd like to thank you for taking time to join us today. We'd like to thank Zoze for the new video, and of course Lisa and Lloyd for the updates today. So on behalf of everybody at the COVID-19 Task Force, Niao ko adano, onigiwahi.